Have you ever found yourself shying away from open-toed sandals or turning down a chance to enjoy a warm day at the beach, all because you're worried about how your toenails look? Many older adults, especially after 70, find themselves dealing with stubborn nail fungal infections that don't just affect appearance, they can also make simple activities uncomfortable. You might experience painful pressure in your toes when walking, or find yourself hesitating to step onto a yoga mat or into a community pool because of self-consciousness. These infections can be surprisingly persistent, and for seniors, the consequences go beyond cosmetics. When toenails become thick or brittle, it can become harder to trim them safely or fit into comfortable shoes, increasing the risk of more serious foot problems down the line. The good news is that it's never too late to take positive steps toward healthier nails. Over the years, more and more seniors have discovered that addressing foot health goes hand in hand with preserving independence and mobility. By focusing on ways to safely manage nail fungal infections, you may find that you also benefit from improved balance, fewer aches, and a renewed sense of confidence. Whether you're strolling around your neighborhood or signing up for that exercise class you've been considering. I've spent considerable time exploring safe, gentle approaches to senior foot health, drawing on insights from experienced medical professionals, geriatric foot care specialists, and everyday seniors who've successfully tackled nail fungal problems. My perspective is not a replacement for medical advice, but rather a collection of practical, evidence-supported strategies that you can discuss with your healthcare provider and adapt to your personal comfort level. Today, I'd like to guide you through 5 safe antifungal remedies that many seniors are turning to for relief. By the time we're done, you'll see how addressing a seemingly minor issue like nail fungus can lead to surprising improvements in your overall well-being. You'll discover how gentle foot soaks, footwear adjustments, and mindful daily habits can not only help clear up the infection, but also boost your sense of safety and control over your health. Each approach is designed to put your protection first, taking into account the unique concerns seniors often face, from sensitive skin to circulation changes. As you listen, think about how these methods might work in your own day-to-day life. If you've had frustrating experiences trying different treatments in the past, or if you've been hesitant to discuss the issue with your doctor, this could be your chance to explore new possibilities. Fungal infections can be surprisingly stubborn, especially later in life, but with consistent, well-informed strategies and a protective mindset, you may find they are more manageable than you once thought. Before we dive into the details, remember, when it comes to foot or nail care, especially if you have diabetes, circulatory challenges, or other chronic conditions, it's always wise to consult with your healthcare provider first. With that reassurance in mind, let's explore 5 approaches that many seniors are finding both effective and comforting. The result isn't just a clearer, healthier nail. It can be a step toward a more active, more confident chapter of life. Let's see what's possible when we prioritize our safety, well-being, and the comfort of our toes. If you've ever felt a twinge of embarrassment slipping off your shoes at the doctor's office, or if you've bought special socks to hide brittle nails, you're far from alone. Now is the time to explore a fresh perspective, one that brings a new level of protection and confidence to your routine. By the end of this journey, you'll have 5 practical tools in your arsenal, ready to be tailored to fit your unique needs. And who knows, you may just be ready to treat yourself to those open-toed shoes once again. The first remedy challenges a common misconception that fungal infections can be washed away quickly with just soap and water. Many seniors believe that a bit of extra scrubbing in the shower is all it takes to handle nail fungus. Yet the reality is that once fungus takes hold under or around the nail, casual washing often isn't enough to reach it. Let me share the story of Leonard, who is 73. For months, he noticed his toenails gradually turning a dull yellow color. He tried being more thorough in the shower, using antibacterial soaps, and even soaking his feet in warm water mixed with Epsom salt. However, the infection only seemed to get worse, sometimes causing his nails to become thick and slightly painful. What Leonard didn't realize is that fungal infections often hide in the deeper layers of the nail and surrounding skin. Soap and water may clean the surface, but they rarely penetrate enough to eliminate the root cause. It's similar to trying to wash off a stain that is soaked deep into a fabric. This is where a specialized antifungal foot soak can help, one that uses ingredients known to create an environment fungus dislikes. Simple options include adding a splash of white vinegar or apple cider vinegar to a basin of warm water. Some people use a few drops of tea tree oil, which has been referenced in multiple sources for its potential antifungal properties. If you do choose tea tree oil, though, make sure to dilute it well, just 1 or 2 drops in a basin, because the pure essential oil can be irritating to sensitive skin. Here's a practical step-by-step approach Leonard eventually embraced. First, he filled a shallow tub with warm water, not hot, to protect his skin, and added about half a cup of white vinegar. Next, he soaked his feet for around 15 to 20 minutes, twice a day at first. After his soak, he gently patted his feet dry with a clean towel, making sure to get between his toes. Then he applied an over-the-counter antifungal cream recommended by his pharmacist. Within a few weeks, he noticed his nails were less discolored and seemed to be growing in healthier. The improvement was slow but steady. The benefits weren't just physical. Leonard felt more in control of his body and less anxious about his foot health. One caution: if your feet are very sensitive or you have open wounds, consult a healthcare provider before trying any soak. Some seniors find vinegar too strong for their skin, so diluting more than usual or soaking less frequently can be helpful. You might want to test a small patch of skin first to see how you react. But for many older adults, this gentle soak, combined with a topical antifungal treatment, can make a world of difference. And beyond the nail fungus itself, the act of a quiet foot soak can be soothing, encouraging relaxation, and providing an opportunity to connect with your body. It's also a good time to inspect your feet carefully for any new calluses, cuts, or changes in color. Early detection can be vital. To review, another strategy many people miss is that proper footwear and sock choices can significantly impact whether nail fungus thrives or fades. It's common to think any clean sock and a pair of well-worn shoes will do just fine, especially when you're mainly walking around the house or running short errands. But the misconception here is assuming that once you treat your nails, the environment inside your shoes doesn't matter. Fungus loves dark, damp places, which unfortunately describes the inside of many shoes worn by seniors who deal with foot perspiration or less frequent sock changes. Consider Millie, who is 77. She developed a stubborn fungal infection during a period when she was exercising at a local gym's indoor pool facility. After her pool sessions, she would slip on cotton socks and rush home. She didn't realize that her socks stayed damp for a while, creating a perfect place for fungi to multiply. Even though she diligently used antifungal sprays and creams, the infection kept recurring. A foot specialist suggested she switch to moisture-wicking socks and look into shoes with better breathability. By opting for socks made from materials like bamboo or synthetic blends that pull sweat away from the skin, Millie noticed her feet stayed drier. She also started rotating her shoes daily, letting each pair air out completely between wears. This simple habit, combined with occasionally using an antifungal shoe spray, turned out to be a crucial part of stopping the cycle of reinfection. If you've ever slipped your feet into damp shoes or socks and thought, "It'll be dry soon enough," you might be giving fungus a chance to set up shop all over again. Focus on prevention. After any activity that causes your feet to sweat or get wet, change into fresh socks right away. Look for shoes that have ventilated designs, and consider placing them in a well-lit, airy spot or even in direct sunlight for a few hours to dry. Some seniors invest in a shoe drying device, but often just giving your shoes enough time to breathe can make a difference. The emotional benefits of this approach may surprise you. When Millie finally found a routine that kept her feet consistently dry, she felt more confident participating in community exercises and social events. She no longer worried about her feet acting up, or that she might spread the infection in shared spaces. Protecting yourself also means protecting those around you. Nail fungus can spread, so by taking these careful steps, you're not just helping yourself, you're contributing to a healthier community environment. If you've tried foot soaks and topical treatments without long-term success, consider footwear and sock changes as the missing link. Combined, these actions build a protective shield around your feet, making it harder for fungus to gain a foothold. Now, here's a quick moment to check in. How many pairs of shoes do you rotate during a typical week? Have you ever considered the material of your socks in relation to foot health? If not, this might be a perfect time to pause and evaluate your shoe situation. Are your socks mostly cotton, or do they include moisture-wicking fibers? Sometimes it's the small shifts in our daily habits that create the biggest difference in keeping our feet safe and healthy. The third remedy often surprises people because it involves paying close attention to the tools you use. Many seniors assume that if you clean your nail clippers or file now and then, that's enough to stop the spread of fungus. Yet after 70, your nails might be more brittle, and you could be trimming them more cautiously. Small nicks or abrasions can be a gateway for fungi to enter. Consider the experience of Roger, age 81, who kept reinfecting his nails despite diligently applying antifungal cream. His daughter, a nurse, noticed he was using the same nail clippers for his infected nail and his healthy nails, sometimes without a thorough cleaning in between. She explained that each nail needs individual attention. If you use one tool across multiple toenails without disinfecting, you can easily spread the fungus from one toe to others, or even to your fingernails. The misconception here is that a quick rinse under hot water counts as cleaning. But to truly reduce the risk, it's important to disinfect your tools properly. This can be done by wiping them with rubbing alcohol before and after each nail, or by soaking them in a small container of disinfectant solution if that feels easier. Many seniors find it helpful to buy separate tools for the infected nails versus the healthy ones and label them, just to avoid accidental cross-contamination. When Roger adopted this practice, he noticed fewer flares of the infection. Over time, he also started cutting his nails after a foot soak when they were slightly softer to minimize the risk of splitting or tearing. If you struggle with mobility issues or have difficulty bending over, consider using long-handled grooming tools designed for seniors. And if your vision isn't what it used to be, you could place a bright lamp near your foot care area or ask a trusted family member to assist. Taking precautions like these does more than protect your nails. It can boost your overall sense of safety. Knowing that you've removed one source of reinfection can give you the peace of mind to focus on healing instead of worrying about setbacks. There's also an emotional aspect to proper tool care. By setting aside a small foot care kit, complete with your nail clippers, file, a disinfectant, and a clean towel, you transform what can feel like a chore into a nurturing ritual. This shift in mindset helps you pay closer attention to changes in your nails from week to week, so you can respond more quickly if you spot any issues. It's an investment in self-care that can enhance your sense of dignity. After all, caring for one's feet is an intimate task, and doing it thoughtfully can empower you to feel more in control, even when facing health challenges in your 70s, 80s, or beyond. The fourth lesser-known tactic for fighting persistent nail fungus involves supporting your body from the inside out. People often think of fungus as a purely external issue. The misconception is that as long as you're attacking the infection on the surface of the nail, you're doing all you can. But seniors with recurring fungal infections sometimes benefit from looking at dietary habits and overall immune support. Picture Evelyn, 75, who struggled with nail fungus for years. Despite trying various foot soaks and topical creams, the problem kept cropping up. She eventually learned that her blood sugar levels were a bit elevated, bordering on prediabetes, and that this could make her more prone to fungal and other infections. Under her doctor's guidance, Evelyn made modest changes in her diet, reducing sugary snacks and processed foods, adding more fresh vegetables, and making sure to stay hydrated. She also took a senior-focused multivitamin, recommended by her healthcare provider, which contained key nutrients like vitamin D and zinc. Over time, as her overall health improved, she noticed her nails looking stronger. While dietary tweaks alone aren't a magic bullet, a healthier internal environment can make it more difficult for fungus to thrive. There's increasing recognition of how our immune system can weaken with age, especially if we have chronic conditions. Supporting your immune system through balanced meals, adequate rest, and moderate exercise could tip the odds in your favor. From a practical standpoint, consider whether you're getting enough nutrients like vitamin C and iron. These help keep skin and nails healthy, which in turn forms a robust barrier against infections. On an emotional level, Evelyn found that focusing on her diet motivated her to improve other areas of her life. She started taking brief daily walks and making new recipes with her friends. The sense of pride she gained from setting and achieving small health goals helped her stay consistent with her topical treatments too. Naturally, if you have a complex medical history or specific dietary restrictions, it's vital to consult with a dietitian or your doctor before making big changes. This approach is about finding synergy between a healthier lifestyle and targeted antifungal measures. When you feel stronger on the inside, you're often more resilient on the outside. If you're currently frustrated by slow progress in dealing with nail fungus, it might be time to check in on your nutritional habits, hydration, and everyday activity levels. Let's pause for a quick self-check. Are you staying hydrated enough? Have you considered cutting down on sugar or adding more nutrient-rich foods to your meals lately? It's easy to get caught up in the latest lotion or cream, but sometimes the key to better nail health starts with the choices we make in the kitchen or during our daily routines. If making dietary shifts feels overwhelming, start small, perhaps with an extra serving of vegetables at dinner or a short walk around the block after lunch. Each simple change can have a cumulative effect, slowly strengthening your immune defenses and making your antifungal efforts more effective. The final remedy involves recognizing when it's time to bring in professional support. Too many seniors assume that, because nail fungus is common, it must be something they can tackle alone. But there's a misconception here. If an infection becomes severe, or if you have underlying conditions like diabetes, it may be crucial to work with a podiatrist or a specialist. Let's take the example of Flora, 82, whose fungal infection progressed to the point where her toenails became exceptionally thick, making it nearly impossible for her to trim them safely. She also felt ongoing pain and was worried about losing her balance when walking. A friend suggested she see a podiatrist who specializes in senior foot care. The specialist not only helped thin out Flora's nails, but also recommended a prescription-strength topical medication that was safer for her specific health profile. The doctor monitored her progress, adjusting the treatment as necessary. As a result, Flora's comfort level improved dramatically, and she regained the confidence to join her church group for a walking tour she'd previously been hesitant to sign up for. For some seniors, professional intervention might also include laser treatments aimed at targeting the fungus beneath the nail, though this can be more expensive and not always covered by insurance. What's important is to know that involving a healthcare professional doesn't mean surrendering your self-care efforts. Rather, it's a collaborative partnership. You still apply the day-to-day routines you've learned, foot soaks, proper footwear, tool cleaning, while benefiting from expert oversight. This combination offers a greater layer of protection and ensures you're not missing any underlying health issues that could be contributing to recurrent infections. When to seek professional help is a personal decision, but if you notice persistent pain, red or swollen skin around the nail, or if the infection seems to be spreading despite your best efforts, it might be time to consult someone. If mobility or eyesight challenges make nail care too difficult, reaching out for assistance can prevent small problems from escalating. Furthermore, seeing a professional can provide an emotional boost. Simply knowing you're not alone in dealing with nail fungus can lift the burden of shame or frustration. Once your nail health improves under professional guidance, you can continue your protective measures at home, staying vigilant about footwear choices, nutritional support, and gentle foot care routines. This ongoing synergy helps maintain progress. Whether you choose an in-office visit, telehealth, or seek guidance from a home health nurse, professional support can be the missing puzzle piece when home remedies aren't quite enough. You've now been introduced to 5 essential strategies: specialized antifungal soaks, proper footwear and sock habits, meticulous grooming tool hygiene, supporting your health from the inside out, and knowing when to seek professional intervention. All these approaches address nail fungus from multiple angles, each reinforcing the other to create a robust defense. By integrating them in a way that respects your comfort level and health conditions, you could see real, lasting improvements in the condition of your nails and your overall foot health. So let's take one more moment to reflect. Which of these remedies resonates most with you? Perhaps you're eager to try a new foot soak or switch your socks to a more breathable fabric. Maybe you'll take the important step of scheduling an appointment with a specialist to finally get a handle on an infection that's been troubling you for months or even years. Remember, each step you take toward better foot care is also a step toward maintaining your independence, confidence, and freedom to keep enjoying the activities that bring you happiness. As we wrap up, imagine a future where you slip on your favorite shoes or flip-flops without a hint of worry. It's not about achieving perfect, magazine-ready nails, though that can happen. It's about regaining comfort and confidence. Small, consistent actions can add up to a significant transformation in your day-to-day experience. Nail fungus might seem like a trivial inconvenience, but if it's causing you pain, embarrassment, or discouraging you from an active life, addressing it can unlock a newfound sense of well-being. If you feel a sense of urgency, that might be a good thing. The sooner you start making thoughtful changes, the sooner you may see results. This doesn't mean you should rush into drastic measures. Always listen to your body and consult healthcare professionals when needed. But do consider that the earlier you intervene, the less entrenched the infection might become. On the flip side, if you've had this problem for a while, it's never too late to take action. Regardless of your age or how long you've dealt with nail fungus, these strategies can offer a meaningful advantage in your fight against stubborn infections. Maybe your first step will be as simple as gathering the items you need for a relaxing foot soak and setting aside a time to pamper yourself. Or you might decide it's time to switch out old shoes or invest in comfortable, breathable new ones. Some of you could be inspired to revamp your dietary habits just a bit, replacing a sugary snack with a piece of fruit or a handful of nuts to nourish both your nails and your energy levels. And if you suspect you need professional help, making that phone call could pave the way to a more comprehensive and effective treatment plan. Each of us has the power to take ownership of our health journey. You hold the wisdom of your life experiences, and combining that with well-researched strategies can be a powerful force. Your feet carry you through all the memories and milestones of your later years. Don't let a fungal infection slow you down or undermine your comfort. Instead, take heart in knowing that with a protective, informed approach, you can safeguard your mobility, your well-being, and your confidence. Now, if you're ready to go deeper, consider sharing this information with a friend or family member who may also be grappling with nail fungus. Encouraging each other can create a supportive circle where you exchange tips, compare progress, and celebrate victories, no matter how small. By joining forces, you reinforce that sense of community and shared experience that makes tackling health challenges easier and less isolating. So here's your multi-layered call to action. For those of you who prefer to ease in, maybe do a relaxing foot soak tonight. If you're up for a bigger change, reevaluate your footwear and sock choices right now. And if you're feeling especially motivated, schedule an appointment with a podiatrist or explore a targeted antifungal treatment plan with a healthcare provider. Each step is significant, and each choice is yours to make. Even the smallest action can have a meaningful ripple effect on your overall well-being. All these insights aim to remind you that you're not powerless against nail fungus. You have plenty of options for nurturing healthier, stronger feet and for staying active well into your later years. Ultimately, the most powerful antidote is your commitment to protecting yourself and maintaining the quality of life you deserve. Aging brings its share of surprises, but it also brings wisdom, resilience, and the kind of resourcefulness that only experience can foster. Trust that part of yourself and let it guide you towards solutions that truly fit your needs. Thank you for taking this journey through 5 antifungal remedies that have helped many seniors reclaim comfort and confidence in their feet. Whether you're just dipping your toes into a new remedy or already taking decisive steps toward a healthier lifestyle, know that you have the ability to make informed, protective choices. Here's to comfortable, happy feet and the freedom to walk, dance, or simply relax without worry, today, tomorrow, and in all the days to come.